my name is Annalisa. I'm going to be demonstrating how to administer TPN and then also how to do dressing change, sectioning, and changing the inner cannula. So my patient is getting TPN because they have squamous cell carcinoma of the throat, so they need to get nutrition through the vein. Okay, so the first thing I'm going to do, hi Fred, my name is Annalisa. I'm going to be your nurse, your student nurse taking care of you today. Just going to do some hand hygiene. I'm going to raise the head of the bed. And I'm coming in and I'm doing a check. I just want to make sure that I have the right patient. So I have Fredrickson, fin 0990127. Okay, so right patient. I'm checking my bag here. And okay, so my physician order says initiate TPN infusion. There's 200 in a 200 ml bag for central. So this is, 2,000. So 2,000 ml. Amino acid, 100 grams. So I have 100 grams there. Dextrose, 200 grams. So I have 200 grams. Lipids, 50 grams. I have 50 grams. And this is to infuse over 24 hours. So my line rate is going to be 83.3 mLs per hour. I'm just going to take my requisition and make sure that that matches up as well. So amino acids, 100 grams, that's right. Dextrose, 200 grams, that's right. Lipids, 250 grams. Okay, that's good. Sodium, I have 120 millimoles. Potassium, 60. Calcium, I have 10 millimoles, that's right. Magnesium, 10, that's right. Phosphate, 15. And chloride 158. So that matches up, and it's a 200 ml, a 2,000 ml bag, so that matches up. Okay, so I have my first check done, and I'm just going. So I have the pump here, and I'm going to go primary. I'm going to go colleague guardian. I'm gonna go label line actually. Okay, so I'm labeling line as TPN. Okay, so I'm going to select. So my rate, my mLs per hour, was the 83.3. Okay, so 83.3. My volume to be infused was the 2,000 mLs. Okay, so 2,000 mLs. All right. So now I'm just going to do another check with the pump. Okay, so I'm going to check. I have Fredrickson, 0990127. So that matches up. I'm doing just a check with, again, my physician orders. I have a 2,000 ml bag, so that's right, 100 grams of amino acids, 200 grams of dextrose, and 50 grams of lipids. So that's all good. To infuse over 24 hours, which gives me a rate of 83.3. Okay, so just gonna do some hand hygiene again. So my patient is supposed to get it through the central line. I'm going to be using the white port, and I'm just gonna check to make sure that it's patent. I'm just gonna set up my flush beforehand. I'm gonna grab the other one because my hands were a little too shaky. Okay. So I'm going to swab for 30 seconds and allow it to dry for 15. push, pause, push, pause. It's flushing with ease, and that's good. Okay, now I'm gonna get my tubing. And I'm just gonna re-swab. "30 seconds, dry for 15. And I have it connected. Everything is good. Okay. So now, before I press start, I would get another nurse to come in and to check everything with me and make sure that everything is correct against the physician orders and the rec. And I'm gonna get them to check the pump. So a second nurse would be there to confirm right now. So my second nurse came in, she confirmed it, I'm confirming primary, and then I'm going to be starting the infusion. My clamps are open, and I'm going to be watching for 3 drops. Okay. So my patient is getting this again for the right reason, because he can't intake anything through his mouth right now, orally. So that's why he's getting it. I'll do the proper documentation on this. He does have the right to refuse, but at this point he agreed with getting the TPN. Okay, so now I'm going to move on to the trach. So I'm just going to perform hand hygiene again, and I'm going to perform my safety checks. So here I'm making sure that everything is connected. I'm making sure that my suction, so I have my suction here. I'm making sure that when I'm actually actively suctioning, it's within the 80 to 120 range. So it's at 100 right now when I'm actively suctioning. Okay, I'm just gonna return a glove. Okay, the orders were for 60% cold pot, and I'm gonna turn the oxygen on all the way. I know that with trach care, I should be wearing a mask and gloves. So that you can hear me for the purposes of this demo, I'm not gonna be wearing a mask. So I am gonna get gloves. Okay, I'm just gonna make sure, so we have normal saline at the bedside. I have the ambu bag. This, I'm gonna be checking the cuff pressure. I'm going to make sure that we have another trach. So my trach was a size 7, so I have a size 7 here, just in case anything were to happen. A replacement inner cannula. So we have replacement inner cannula, extra trach ties, extra gauze, and the dilators, okay, in case of an emergency. All right, so before I check cuff pressure, I have to suction the patient. Okay. So everything is unclamped. Do you want to wave them down? Yeah. Oh, it stopped. It stopped. Okay. All right. So I have to suction my patient. Yeah, it stopped. So prior to suctioning, my patient is able to take breaths on their own. I put the oxygen up all the way, just so that you can hear me. I'm going to turn the oxygen off, but it would be on. My patient would have an OSAT monitor on, and so I would instruct my patient, can you take 2 to 3 deep breaths for me? We're going to watch their oxygen go up to 100%. Okay. Yeah, I just want to go get them.
It keeps something like downward occlusion every now and then, so should we just like put it on standby for now? Like it'll fix itself and then it'll start
Keeps
beeping.
on beeping and then fixes itself.
And it's probably just,
Yeah.
You
Okay.
finished with this portion?
Yeah, I finished with that portion of it.
Okay, I'm just gonna turn it off.
Okay. Okay, so I have, for sectioning, I have selected a 10 French. The reason why I know this is the right tube is because my patient has a size 7 trach tube. I go minus that times 2, which gives me 10. Okay, so now I'm gonna double check again that while I'm actively suctioning, it's within the 80 to 120 range. Okay, I'm gonna connect. My patient's oxygen saturation is at 100%. They've taken a couple of deep breaths. And I'm going to remove their oxygen source now. Okay, so I'm just gonna check again. Good, I'm within the 80 to 120 here. And as I'm withdrawing this, I'm keeping the first 5 inches sterile. And I'm going to insert. While I'm inserting, I'm not going to actively suction. I'm going to go until I hit the bifurcation, which I did, and then I'm going to do intermittent suctioning, twisting. And I'm not suctioning for more than 10 to 15 seconds. Okay, now that I'm done suctioning, if I went in for a second pass, I would need a new tube, but I'm not going to go in for another pass. I cleared this tubing with sterile water or normal saline. Okay, so that's good. Now, I'm going to be checking cuff pressure. And I'm just going to get actually... Okay. Another alcohol swab. Sure.
Get it back.
Okay, thank you. So I'm swabbing this part with alcohol, and then I'm also going to be swabbing where I'm checking for the cuff pressure. Okay. Clean for 30 seconds, allowed to dry. Okay, so I'm checking cuff pressure. I'm making sure that it's in the 20 to 30 range, and it is. So the cuff pressure is good. Okay, I'm going to close that now. And I'm going to return that. Okay, so now cuff pressure is done. Now I'm going to demonstrate how to do the dressing change and the inner cannula change. Okay. So my patient has their oxygen monitor on, and they're still at 98%. So they're doing good. And I'm just going to set up my tray. And then also get the size 7 inner cannula for when I change it. Okay. And I'm being mindful of where my forceps are, so they're right here. Okay. I'm just gonna put that right there. And I'm using sterile no touch technique, so I'm just gonna bring my forceps out. My garbage. Okay. And I'm gonna get an extra dressing. And I'm gonna get my swab. now that I have that, I'm gonna put on new clean gloves. Actually, I'm just gonna open up my inner cannula packaging. Okay. Perform hand hygiene and put on new clean gloves. Oxygen sat is still at 98%, so my patient is okay for oxygen. Okay, I'm gonna remove your inner cannula now. Okay, so now this goes in the garbage along with my gloves. I'm gonna perform hand hygiene and put on new clean gloves. And I'm only touching with the inner cannula just this top portion, okay? Keeping everything else sterile and kind of coming in from an angle. Now in Jake, he's a little bit more stiff, so it's actually a little harder to put this inner cannula in on him. But I'm still making sure that I'm only touching the top, okay? So I touch the top. Now I'm gonna dispose of this, assess the stoma site. I'm gonna take off my gloves, perform hand hygiene, put on new clean gloves. The stoma looks good. And now I can get to cleaning. Okay, I'm gonna put my normal saline. Okay, so I'm gonna start with dipping here, and I'm doing one swipe per wipe. So I'm starting at the bottom and doing like a U, disposing of that. And I'm gonna go on the top, a U, dispose of. And an outer portion, good. Outer portion. Now I'm just gonna take some 2x2. Okay. Okay, top again. Good. And now I'm just going to dry. Okay. And dry the top. Okay. So now that it's dry, I'm ready to put the new dressing. I'm just gonna try to fold it into a little making sure that I keep the center part sterile. Okay, and I'm just going to take cotton tip and push it up. And now that I have that, I'm just touching the outer portion. Okay. And I'm going to come back, I'm going to check up on my patient, I'm going to document everything that I did. My patient does have the right to refuse to what I did, but he didn't. And I'm doing the right teaching and evaluation. And I'm done.